I'm Shilander Bhatia. I'm a medical oncologist. Clinical trials essentially is using a treatment strategy which is not considered standard for a patient situation. Most of the clinical trials are using a strategy that aims at improving the deficiencies that exist with standard technology. A well-designed clinical trial always will take into account the patient's best interest and aim at solving a problem which is actually going to make a real meaningful difference in a patient's life.
My name is Cassio, and I'm a research coordinator at the Seattle Cancer Care Alliance. The research coordinators, they help kind of connect everybody together to make that one big flow of the protocol trial. And so research coordinators, they communicate with the doctors, going through background history on the patients. They communicate with nurses to hear of any sudden instances with the patients. We communicate with pharmacists. We communicate with the infusion nurses here. Everyone is connected in a way just to make one patient visit flow and be successful.
I think the most important thing from a patient perspective about clinical trials should be to keep an open mind, have an honest, in-depth discussion about the limitations of the standard treatment, and ask your physician as to what can be done to improve on the potential treatment options.
The visit includes documenting any kind of side effect that they have been experiencing. We ask them about their medications, any change during the trial, and sometimes we just like to talk. Any patient that walks in, everything that they talk about, whether it's a part of their personal life or maybe specifically about the trial that they're participating in, it definitely stays in the room. We talk like we're friends, we're buddies. When we meet for the first time on the first day that they're here, we introduce ourselves and we just talk about anything. And so I think that's one of the most fun things about seeing patients. It's like a conversation.
We have seen tremendous progress in the way we think about cancer and the way we treat cancer in the last few years. There has been progress on multiple fronts. We have improved techniques to diagnose cancer. We have better ways of treating cancer. And hopefully, with all this progress, we will have even better ways to prevent cancer from developing in the future.